for Dr. Avinash. I'm sure you must be getting people complaining that I have a lot of repetitive, disturbing thoughts and पता नहीं इसको कैसे रोकना है and क्या करना है. So what would be your action or advice in that scenario? Dr. Avinash, you're on mute.
It's important first that we differentiate with regard to what the repetitive thoughts are about. So are we looking at just rumination, that is repetitive thoughts that you see in depression, or are we looking at obsessive thoughts wherein you have repeated thoughts which are intrusive, and whether these are obsessions and they form a part of what we refer to as OCD or obsessive compulsive disorder?
Absolutely.
Now, generally, anyone with repetitive thoughts needs a combination of both medical and psychotherapeutic intervention. So one is, I would advise them to get onto little medication. I mean, their fears about medication. I mean, I wish to tell everyone that in 2021, we have safe medications which are not going to make you addictive. We're not going to just dope you or make you drowsy. We're not here to just hook you onto our medicines. No, the whole aim is all psychiatric problems are also biological in nature. So we have to act at a brain level and at a mind level. The mind is a functioning component of the brain. So one of the things which we have to also work is at a therapy level. So the therapy could involve you using some kind of a CBT technique to challenge the thoughts. It could also involve maybe a combination of CBT and REBT. It could involve a combination of other therapies. So multiple psychotherapeutic treatments are available. There's schema-based therapies. Multiple things are available. So it's totally up to the therapist what school he or she chooses to use. But I think the most prudent way would be that to combine medication and psychotherapy, because both mutually benefit each other. And
Absolutely.
I think the patient would do well there. Yeah.
Absolutely. Yeah. So I think that's a great, response, because I think today the fear, though people are quite open to the idea of going like, Shenaaz ma'am also said, to go to, for your physical issues, they will definitely go to a doctor, but for mental issues, they take their time. And then after that, medication becomes a very big deal, because without the prescriptions, the pharmacy doesn't give them the medicines, right? So
Right.
I think that also becomes a kind of a stigma, right? That तुम पागल हो इसलिए गोली ले रही हो, that kind of a thing also. Then that's
Right.
a new thought that that can set into the person basically, right? At some point. So yeah, I think I think it's a good combination to go in for counseling and also take medical help side by side.